I'm Dr. Jameson Spencer. I'm going to talk a little bit about snoring and sleep apnea in general and how oral appliance therapy can be helpful for those conditions. So snoring is simply a sound typically generated at the back of the throat. It may be related to sleep apnea. Most people with sleep apnea do snore. Some people just snore. Your medical doctor or sleep specialist will be the one to make a evaluation of whether your snoring may be related to obstructive sleep apnea, which is a serious health concern. With both of these problems, though, with snoring and sleep apnea, it has to do with a narrowing of the airway. I have a poster here that shows a open airway, and this shows a person kind of cut down the middle here with the tongue and the nose. And with an open airway, you see the air flowing through the nose or through the mouth and going down the trachea into the lungs. And this is the way we should breathe, ideally breathing through our nose and having no obstruction. So that's a normal airway. Down here we have an obstructed airway. You can see from this illustration that the tongue tends to fall back. This shows the uvula being a little bit larger in this patient, or there may be other obstructive things such as tonsils or adenoids that get in the way here. But bottom line is that the airway will obstruct and air cannot pass down as it should normally. Then we have how an oral appliance works. So the obstructed airway with the tongue falling back, with an oral appliance we can bring the jaw forward, thus bringing the tongue forward and opening the airway, allowing the patient again to breathe through their nose or their mouth and have the air go down like it should. CPAP works by forcing air through the nose or nose and mouth and keeping the airway open with a pillar of air. For those who are unable to tolerate CPAP, an oral appliance works simply by keeping the jaw from falling backwards. This is similar to what is done in CPR when a person may use a head tilt chin lift procedure to open the airway before giving the patient breaths in a CPR setting. Oral appliances work in that same way to keep the jaw from falling back and obstructing the airway.